Our patient is a 62-year-old male presenting to the clinic with chief complaints of fatigue and irritability. He's a type 2 diabetic that has been previously well controlled with oral medication. He has hyperlipidemia, and he is also being treated for depression. Our patient states that these symptoms started 2 to 2.5 weeks ago, and that he's been feeling tired all the time and has been more upset with others since their onset. He says he's been having issues getting along with his coworkers at work, and that he has not been getting much sleep at night because he lies in bed and thinks about his arguments with his coworkers. ROS is pertinent for decreased appetite and weight loss. In fact, our patient has lost 9 pounds since his last visit, and that was 3 months ago. The patient also endorses Blue Mood and anhedonia and asks about these symptoms. Patient has had an appendectomy. He had that when he was a teenager, but he doesn't know the exact age at which he had that surgery. His medications include Zoloft, 50 milligrams a day, Lipitor, 20 milligrams a day, and metformin, 850 milligrams a day. And as we said, this metformin has been well controlling his diabetes. Patient states he has no allergies. Social history is very significant for a recent separation from his wife 6 weeks ago. Patient states that he has been living in a different house since then, and since the move he stopped exercising. He has been getting most of his meals from fast food restaurants, and his alcohol intake has increased slightly to 2 to 3 6-packs of beer per week. Family history is also significant for a mother who suffered from depression. Physical exam is unremarkable. For our differential diagnosis, our first diagnosis is going to be depression, exacerbated by his recent separation from his wife and his recent move to a new house. Our second diagnosis is going to be insomnia that is causing his fatigue and irritability at work, and this could be because he's adapting to a new situation, a new environment, and just hasn't gotten to a good sleep cycle yet. To address these differentials for depression, we would like to increase his dose of Zoloft from 50 milligrams a day to 100 milligrams a day, and then see him back in a month. If his symptoms have not improved in that time, we would like to replace his Zoloft with Prozac due to the fact that he has been on the Zoloft for over 2 years, and it could be waning in its effectiveness. For insomnia, we would like to refer him to sleep medicine to get polysomnography and consider prescribing Ambien if depression is not the main cause of his insomnia. We would also like to counsel our patient on healthy eating habits, considering that his lipids and his A1C are slightly elevated from his last visit. This is probably just due to his increase in intake of fast food and the fact that he stopped exercising, and we just want to stress the importance of those factors. We'd also like to talk about coping strategies with our patient to deal with his recent separation from his wife and provide resources for counseling should he consider that to be a beneficial tool in helping him cope.